I'm one of those people that early on said, eventually we're all going to have to go to the cloud because you're not going to be able to build out this AI stack in your own data center. And here we are a couple of years later, and I'm eating my words. It really is kind of exciting, and it does open up a lot of opportunities. Talk about some of the partners you're going to have and showcase at the HIMSS booth.
We'll have a number of different demonstrations at the VMware booth. We'll be working with iCAD, and there's a session on Tuesday. This is in booth 2121 at the VMware booth. They'll be talking about how their iCAD breast health solutions help work with clinicians in terms of the breast cancer diagnosis. What they'll be showing is how this stack can deploy now for enterprises run on top of NVIDIA AI Enterprise with VMware helping to drive that virtualization layer. They'll be talking about what this means for IT departments who are responsible for deploying and supporting these applications driving forward. On Wednesday, March 16th, there will be a session with Rhino Health and the ACR. They'll be demonstrating using federated learning inside of hospitals to help drive the creation of AI across many different institutions. Going back a year, when we create AI, we have to pool all of our data together, all of our annotated data, where we would do our training of AI models. This is problematic in healthcare because typically we want to get data sets from many different modalities, many different instruments, many different instrument vendors. But these are across many different hospitals, and we have to really think very carefully on protecting patient privacy. With federated learning, with what Rhino Health will be demonstrating, is how we can actually leave the data at the hospitals, but train the model together. And what we do to drive, using NVIDIA Flare, which is our SDK to help drive this, is move the training from a centralized place and have it run at every individual hospital where the data is. And then we share that AI model back up and create one giant AI model that generalizes for all those different hospitals, but we're still protecting that patient-sensitive data at all the individual locations. So this is what we'll be demonstrating at the booth on March 16th.